Good afternoon, everyone. My name is Paloma Martínez. I'm a pediatric nurse specialist at La Paz University Hospital in Madrid. And together with Maria Jesus Pascal, coordinator of the follow-up and transition program and coordinator of the dissemination working group at TransplantChild, we are carrying out the follow-up and transition consultation of solid organ transplantation. So first of all, I would like to thank everyone for being here, and also TransplantChild for giving us the opportunity to give a nursing webinar. It's a pleasure, and I hope you like it and that we can learn together by sharing experiences. So there are several programs at our nursing consultation, but today I'm going to focus on our transition program, named Nursing Educational Reinforcement Program for the Transition in Solid Organ Transplantation, RETTOS. This project is not very old, actually it's 2 years old right now, and I'm going to try to summarize and clarify the work we do as pediatric nurses. So one of the reasons why we are carrying out this follow-up and transition consultation at La Paz University Hospital is because our hospital has performed the highest number of pediatric solid organ transplants in Spain in 2023. And here we can see that 190 pediatric transplants have been performed last year in Spain, and 60 of them were performed at La Paz. And here you can see the percentages where, for example, 43% were liver transplants. And much of the success of pediatric transplantation is reflected in survival rates, which means that there is a growing population of adolescents and young adults, the AYAs, who must face a transfer to adults. And recently, the ERN TransplantChild has published the recommendations on implementation of transition and transfer. This tool is very useful, and you can find it on the website. So, transplantation as a chronic health condition represents for the patients and the families a crisis situation, which leads to a consequent loss and acceptance and an adaptation through tools such as resilience and empowerment in the face of the demands of the health situation. And what can we do as nurses at our consultation? So we accompany and give continuity of the process. So our follow-up and transition consultation for solid organ transplantation is led by pediatric nurses, and we have started with liver transplantation, but we are also carrying it out in kidney transplantation. The nurse of the nephrology unit is doing it. Also multivisceral transplantation, other nurses are doing that. And we are doing lung transplantation and heart transplantation as well. So our aim at our consultation is to provide this transition program in all types of transplantation. So this is the diagram of our consultation. I think it's quite visual. And here you can see that we not only carry out the transition program, but also other interventions. For example, in the pre-transplant phase, we have a host program in which at the time the patients enter the transplant waiting list, we explain what is going to happen, we resolve doubts, and we provide an approach to the hospital environment and the professionals involved. And after the transplant, in the post-transplant phase, specifically in the immediate post-transplant phase, We provide health education to the families so that they are prepared for discharge. And we give this training at the family school with other nurses of the Pediatric Transplant Unit. And then once they are at home, we follow up by telephone upon discharge. And when our patients turn 12 years old, they enter the transition program. And during all these interventions, in turn, we do case management if they need it, such as coordinating with school, health centers, associations, social work, mental health. But today, in this presentation, I'm going to focus just on the transition program. And what is transition? So according to evidence, transition is the intentional and planned movement of adolescents and young adults, the AYAs, with chronic conditions to adult health services. So we say it's like establishing a bridge between the children's hospital and adult services. So we, as the transition team, we function like a link between the pediatric care team and transplant unit and the adult care team. But in this period, the adolescents and young adults, AYAs, experience multiple factors that make this transition process complex, such as emotional interdependence between them and the pediatric units, because they feel safe in the environment where the disease was diagnosed and where the transplant was performed. Structural and operational differences. Every change involves an effort to adapt, and there is an initial resistance to change. Lack of trust. They feel safe with people they know, the pediatric units, and they distrust the unknown, so the adult doctors. Lack of knowledge on the part of adult doctors about diseases that cause a transplant in childhood. This is very normal because the diseases that cause a transplant in adulthood are different. Various origins in a pediatric unit. This is quite important as La Paz Hospital is a reference center for pediatric transplantation, and it concentrates patients from different origins in Spain. The AYAs feel normally asymptomatic after the transplantation. They do not perceive appreciable consequences. Many times they don't take medication because they don't feel sick. Physical and psychological changes that characterize adolescents, such as risk behaviors, greater possibility of non-adherence, and overconfidence in one's own capacity for self-care. And these attitudes are related to incomplete brain maturity, because the brain continues to develop after the 20s. So our main objectives of the program are to promote efficient and effective continuity of care that helps AYAs transplanted in childhood to maintain and improve clinical status, improve their quality of life, be able to make informed decisions regarding their health and care inconsistent with their values, facilitate their adaptation to a satisfactory adult life, and promote their constructive participation in the society of which they are a part. So, transition must have a multidisciplinary care team with a biopsychosocial approach, with a comprehensive and individualized care covering all the needs the patients arise, person-centered approach with specialized professionals who understand physical and psychological needs and who take into account social, emotional, and behavioral dimensions. and who support the patients before, during, and after transition process and the transfer. So the aims to provide this continuity of care, promoting their well-being and successful transition, are teaching them self-care, so how to manage their healthcare, how to follow a healthy lifestyle, teaching them how to be independent in making decisions. The British program Ready, Steady, Go teaches them to ask 3 questions about options, medical options they can have in their healthcare. And these are: what are my choices? What is good and bad about each choice? And how do I get support to help me make a decision that is right for me? And our third aim is teaching them self-determination, so motivate them. Okay, this is the transition planning TransplantChild has elaborated. So transition starts at the age of 12 until the age of 18. Normally at this age, transfer occurs. That's the typical age of transfer, but it depends on patient-specific factors, and sometimes it can be later. So the first transition consultation, as I said, happens when the AYAs turn 12 years old. So when they come for outpatient medical checkups, normally they come every 3-4 months, and they come also to our nursing consultation. So on this first visit, we provide an information brochure. It's this one, and we explain what the consultation consists of. We give our contact details, and we show them resources about transplantation. For example, the TransplantChild information pills, which are interactive educational videos on important topics about adolescents and transplantation. The topics are, for example, school after transplantation, solar radiation, sports and active life, pets and animals, friends, tattoos and piercings, alcohol, drugs. And they are based on the recommendations guide for transplanted children that TransplantChild has also elaborated. So on this first visit, normally, we carry out an initial assessment through the HETS questionnaire to explore needs that the AYAs have. You know, HETS, it's an acronym for the topics we're going to talk about. For example, age from home, and we ask, where are you living? With who do you live? What are your relationships like? Education, are you going to school? How are you doing at school? Do you experience bullying? Eating, what are your eating habits? Do you have any hobbies? How much time do you spend on internet? About drugs, do your friends or family use tobacco, alcohol, or drugs? Sexuality, have you had previous or do you have a current relationship? What's your sexual orientation? About feelings also, how are you feeling? Are you feeling sad? Do you take any medication? Or safety, do you feel safe? Have you experienced any violence at home or school? So this way gives us an idea of where we are going to start in our program, or if we need to prioritize any topic. So, based on other programs of transition, such as the On Track for Health from Canada or the Ready, Steady, Go, that's the British program, we have elaborated our own healthcare knowledge and skills checklist. So we carried them out 3 times during the transition process to see their progress. So we carried them out at the age of 12, 13 years, then 14, 16 years, and the last one, 17, 18 years. right before the transfer moment to the adult services. So these are our checklists. They have the same colors as the Ready, Steady, Go program. And it's important to know that we evaluate knowledge, but also the skills. For example, it's interesting to know if they know what medication they are taking, but also if they are taking it, or if they use resources to remember that they have to take a medication. And we evaluate also the pediatric quality of life through the PETSQL inventory with the transplant module that is validated in Spanish language. And this is our nursing educational reinforcement program named RETTOS. We have 18 sessions lasting 20-30 minutes per session, more or less. And this program is divided into 3 stages or modules and are aimed at 3 ages ranges. So module 1 occurs at the age of 12-13 years old, module 2 14 years old, and the last one at the age of 17-18 years old. So it is very important to adapt the contents individually according to age, maturity, disposition, and context. Normally, they go to the consultation alone. During the module 1, they usually come with the parents to the consultation, but from the session 7-8, they go to the consultation alone and they ask for it. So when the transplant, for example, occurs after 12 years old, it is also necessary to adapt this program. And about the topics, at first, we teach them basic notions about transplantation. For example, we ask them, do you know what a transplant is? Do you know why you are transplanted? Do you know what the main functions of the liver, of the heart, of the kidney are? Because most of them don't know. About medication, with this whiteboard and magnets with the images of the medicines, we teach them to learn their medication. The names, the doses, what their medication is for, the side effects, and we give them also a workshop where they can practice to prepare a pill box and to set the alarms to remember they have to take their medication. About nutrition, we teach them how to follow a healthy and balanced diet, and we explain the food groups and the nutritional pyramid. But what they find most enjoyable is doing a practical workshop where we ask them to create a menu of the day and with these food toys. About exercise, we talk about the benefits of doing physical exercise and the risks that come with not doing it. And we try to motivate them to look for a sport they like, which is a bit difficult sometimes. And about alcohol, tobacco, and drugs, of course, we talk about the risks that this entails, but we give alternatives. For example, non-alcoholic drinks. And we carry out also a role-playing game where they can practice strategies to say no in the face of peer pressure. About emotional and sexual relationships, we start from the beginning and we teach and talk about how beautiful and is to have a healthy relationship. We talk about tolerance, about respect. We have also a menstruation workshop because we realized there was a lot of ignorance and girls needed support about this topic. Also, we give STD prevention and contraception information, and Here I like to highlight this article from Marianne Samin, which says that providing information on safe sexual intercourse to avoid sexually transmitted infections is essential in transition. About mental health, we talk about emotion management. We have workshops about identity, self-esteem, confrontation, and friends. And if it's necessary, we coordinate with psychologists. About studies and employment, we give information and we try to orientate them if it's necessary. And about resources, we give information, for example, about the organic disability, that's a right they have because they are transplanted. And if it's recognized, normally they don't have to pay their medication, or it's easier for them to get to university, so that's quite important. And our last session normally is the transfer preparation, where we teach them how to read and interpret a medical report. We teach them how to manage appointments or medication at the pharmacy. We talk about vaccinations and we explain them how primary care works. And the last part of the transition is the transfer. So the minimum criteria is to be at the age of 18, to have a clinical stability. Normally we have a meeting with the doctors once per month, and we decide who of the patients might transfer to adult services. Have achieved at least 70% of the transition training objectives with the knowledge and skills checklists I have explained before, and psychological maturity enough to take charge of their own health. So, if transfer is decided, we contact and coordinate with all the different pediatric specialties. This is quite important because most of the patients are followed by many specialties, so we try to carry out the transfer at the same time. We contact and coordinate with all the adult centers. So 70% of the patients we have are from other parts from Spain, different than Madrid. So that's quite difficult for us to do this transfer because we have to contact them. We coordinate with other resources, doing an individualized case management if it's necessary. We carry out our discharge reports and we send them to the adult services, and we have contact with the AYAs for at least 1 year after the transfer. So this is our nursing discharge report, where we write the skills and the knowledge they have achieved. And about transition, nowadays we have Nowadays we have 186 AYAs included in the program. Maria Jesus and me are responsible for liver transplantation, heart and lung transplantation, and 54 of the patients have already transferred to adults. And here are the results. I'm going to talk only about liver transplant results because it is the one that is most developed. So here are the social demographic results, but I may want to highlight, for example, that 30% reside in Madrid. This means the great difficulty that it represents to do the transition. And here, for example, up to 15% of the AYAs had immunosuppressant levels out of range. That's why medication education is very important. And up to 92% of the AYAs are being monitored by another medical service. That's why I said that we try to do the transfer of all the specialties at the same time. Almost 22% present some type of social family condition, and almost 20% present some type of neurodevelopmental disorder requiring curricular adaptation and special education. So one of the limitations we have encountered in our program is that we only carry out individual sessions. So according to the literature of Alison Darcy and Marianne Samin, they say that peer support is very, very important and has lots of benefits in transition. So we are planning a transition day, Saturday, 22nd of June, and we are going to convoke 15-20 transplanted AYAs of transition age, where we are going to alternate workshops with parents about self-care, emotional, sexual education, toxic habits, mental health, leisure, and free time. So they meet each other and they share experiences. And about conclusions, the implementation of the RETTOS program led by pediatric nurses is feasible, and the satisfaction of the AYAs included in the program has increased. That there is a need for greater focus in several topics. For example, the responsibility for their care is shared with parents in most of the cases after transfer. There is a high prevalence of emotional needs to feel heard and mental health problems. There is a greater difficulty in self-care if there are social family problems, and there is a lack of basic knowledge and existing social resources. And about the difficulties for the implementation of our consultation, we don't have a specific physical space. We use medical consultation spaces. We don't have many resources. It's just María Jesús and me for liver, heart, and lung transplantation. And we would like to have a specific multidisciplinary team because we coordinate with other professionals of mental health or social work, for example, in the hospital. But it would be very interesting if we could have like a specific team for transplantation, and that more research is needed to assess the impact of this program, RETTOS. So thank you very much for your attention.